As a population, we can't expect this to go away.
Quebec has now reached 30 cases of measles as of March 4th, according to the most recent public health figures, with areas like the Laurentians region remaining the most affected with 23, while Montreal, Laval, and Montérégie are experiencing less than 5 each.
This virus will continue to infect people, and we will have more people not only infected, but affected and hospitalized and sick, and unfortunately potentially even die.
The numbers always don't surprise me, but they concern me. If you have a susceptible population who are not vaccinated and have been exposed, the numbers will only go up.
Main symptoms of measles are high fever, cough, runny nose, red eyes, and redness of the face and body. Serious complications can occur for vulnerable people, especially babies who have not yet been vaccinated.
The impact is that it is probably one of the most contagious infections out there, combined with a vaccination rate that is good, but not at the level that we need to have what we call herd immunity.
Ontario has reported 84 new cases of measles in the past 2 weeks. The United States is also seeing a rise in the spread of the disease. Last week, the first measles death in a decade occurred in Texas after a child died.
The start of 2025 was 2 months ago, right? So in that 2 months, we have about 100 cases nationwide. We have about 30 cases in Quebec. Just to put in perspective, at the end of 2024, nationwide, we had 145 cases. So we are really on a bad pace.
Quebec's vaccination schedule requires children to receive the vaccine at 12 and 18 months, and it can be administered free of charge at any age.
That virus has very much trouble trying to infect them. It has very much no capacity to be transmitted from a vaccinated person to somebody else, and therefore that's a dead end for the virus.
Both doctors urge Quebecers to get vaccinated, and for those who are hesitant, to consult their physician with any concerns.
A vaccine-preventable disease is a trophy of medicine. It represents decades, if not a century's worth, of science that tried to create ways to prevent morbidity and mortality in humans through science.
In Montreal, Tehosterihens Deer, City News.